Bismillahirrahmanirrahim. Questionnaire Development, the ultimate guide for doctors. Questionnaire development in medical research an essential step in collecting accurate and reliable data for your study. A well-designed questionnaire ensures that your research findings are valid, measurable, and truly reflect the participants' responses. Learning objectives. Define the questionnaire, stages of questionnaire in designing the questionnaire, types of information and types of questions, and questionnaire wording, sequence, skip patterns, lengths, and layout. It is not every question that deserves an answer. Publius Cyrus. What is a questionnaire? A questionnaire is a standardized structured instrument that is administered in a standard way to a desired sample of population of interest. Questionnaires are best used when we need large number of respondents in many locations. You want fairly straightforward information like yes and no options, standardized data from identical questions. You are more interested in what occurred rather than why or how. Advantages of questionnaire can reach a large number of people relatively easy and economically. Provide quantifiable answers relatively easy to analyze. Disadvantages of questionnaire. Provide only limited insight into problem, limited responses allowed by questions, varying response, misunderstanding, misinterpretation. Need to be it right first time. Hard to chase after missing data. Here we consider a published article in 2014, prevalence of anxiety and depression and their associated risk factor among engineering students in Karachi, Pakistan. To designing a questionnaire, stage 1 is the planning of the study, decide the goal, identify associated risk factor of anxiety and depression among engineering students in Karachi, Pakistan. And the second point is know the subject. Literature, expert on anxiety and depression means psychiatrist. Formulate a hypothesis. Failed, got supplementary in exam. Engineering students more likely depressed than past students who have got supply. Define information needed to test hypothesis. One of the tool anxiety and depression scale like Aga Khan University anxiety and depression scale got supply, substance abuse, depressed family members, sex, type of family. We use this tool Aga Khan University anxiety and depression scale. In this tool 25 items, 13 psychological and 12 somatic. The specificity of the tool is 81% and the sensitivity of 71%. This tool is published by Badr S. Ali 1998. These are the items, 25 items. The options are don't know, give the 9 mark, never 0, sometimes 1, mostly 2, and always 3. The cutoff of the tool is 19. If a person 18 and more than 19 score, we diagnosed this person as anxiety and depression. Stage 2 in designing the questionnaire. Determine the population. Know the respondents, age, sex, substance abuse, depressed family member, type of family. Questionnaire need to be modified to your population, not the opposite. Stage 3. Design questions. The first point is content of the questions, means all contents included in the questionnaire, format of the questions, and the presentation and layout of the questions, coding schedules if appropriate, means if the question is what is your gender, coding 1 for male and 2 for female. Pre-testing and refined questionnaire. Here we use a sample questionnaire format. The title of the questionnaire is Assessment of Knowledge of Diabetes using Diabetes Knowledge Questionnaire DKQ among type 2 diabetics in a tertiary care hospital in Karachi. We divided this questionnaire in 4 sessions. Section 1, demographics, age, gender, area, occupation, marital status, ethnicity, education, and income, we noted. In section 2, diabetic profile. When was your diabetic first diagnosed? How was it diagnosed? Do you like do you take your prescribed medicine? And in the next page, if no or don't know, then skip question 4. Here we ask 10 questions in section 2 diabetic profile. In section 3, we use diabetes knowledge questionnaire DKQ. In this questionnaire, we assess the knowledge of diabetic type 2 patients about diabetes. Here we have 24 questions, and lastly in section 4, client satisfaction about the services or hospital services. In this tool, total 8 questions. We having 8 questions. Questionnaire. Other methods of collecting data from individuals may be more useful if you are interested in gaining a more in-depth understanding of the particular issue, or where particularly sensitive information is sought. This may be useful when developing questionnaires by identifying issues of concerns. Semi-structured interviews. A semi-structured interview is open, allowing new ideas to be brought up during the interview as a result of what the interviewing says. Focus group. A small number of people, usually between 4 to 15, typically add together with a moderator to focus on a specific topic. Formal questions, discussions, preference and beliefs produce qualitative data may not be representative of the general population. Questionnaire can be administered either by mail, telephone, self-administered, face-to-face interviews, hospital records. Self-administered questionnaire advantages. Cheap and easy to administer, have confidentiality, completed at respondent's convenience, no influence by interviewer. Disadvantages of self-administered questionnaire. Low response rate, questions can be misunderstood, no control by interviewer, time and resources loss. Advantages of interview administered questionnaire. Participation by illiterate people, clarification of ambiguity, quick answers. Disadvantages: interviewer bias, need more resources, only short questionnaires possible, especially on telephone. Difficult for sensitive issues. Types of information collected in a questionnaire. There are four main types of information collected through questionnaires. These are knowledge, what people know, opinion, attitudes, beliefs, values, what people think, behavior, practices, what people do, attributes, health status, psychological state, what people are. Usually questionnaire will collect more than one type of information. With any questionnaire, you need to be clear about its purpose. Clarifying this will determine the type of information collected as well as the questions you include. The information or data collected in your questionnaire will be linked to your research need and the outcomes, activities, and indicators included in your protocol. Example of different types of information collected in a questionnaire. Knowledge. What is the recommended interval between eye checks for patient with uncomplicated diabetes? 6 months. Option 2 is 1 year. Option 3 is 2 year. Second example for opinions. Dentists should present all treatments options to patients. One Option 1 is strongly agree, 2 agree, 3 disagree, and 4 strongly disagree. Behavior. How many hours after birth did you start with breastfeeding? Option 1, 1 to 4 hours. Option 2, 5 to 12 hours. Option 3, after 12 hours. Option 9, don't know. Attributes: systolic blood pressure at admission, millimercury Hg, mmHg, diastolic blood pressure at admission. Structure of questions used in a questionnaire. Broadly, there are two types of structure of questions used in survey: open-ended questions, no answer choice. Respondents are able to answer in their own words. Close-ended questions, answer is structured so they only fit into previously established categories. Partially closed. Questions can be partially closed, where respondents can choose from fixed categories and add their own responses if desired. Types of questions used in a questionnaire. Choice of type of questions will depend on the subject matter. For example, in clinical and epidemiological studies may require quick coding methods and minimal detail, therefore close-ended questions may be more suitable. Social assessment or need assessment may require a greater appreciation of individual differences or underlying issue, and open-ended question may be needed. Open-ended questions are often useful at the beginning of the studies to develop responses categories for close-ended questions. Here are some examples for the format of the questions. The first format is a statement. What do you think about the quality of the discharge summarize from the local hospital? This is an open-ended question. A list question format. Please list the issue you are feel are the most important for your department to address in the next 12 months. It is also a open-ended questions, but here we provide a list. Third format is a yes and no answer. Are you currently taking any medication for controlling your blood pressure? Option 1 is yes, option 2 is no. Because our format is yes and no. Format 4, agree and disagree with a statement. Do you agree or disagree with the following statement? If a pregnant woman takes a vitamin mineral supplement, it is not important that she eats a well balanced diet. Agree, disagree. Multiple choice format with a one possible answer. Question: what is the most common reason for attendance at the journal practice? Diabetes, asthma, hypertension. Sixth format: which of the following symptoms have you experienced in the last month? Multiple choice allowing multiple responses: headache, dizziness, fever, vomiting, inability to sleep, skin rashes, shortness of breath. Here we allowed to multiple choices means we select more than one options in this format of question. Rank order. Which of these factors are most important in your decision to use either an extraction or a root canal? Most important, 1, 2 is second most important, and 5 is least important. Age of patient, medical history condition, patient preference, oral hygiene status, number of missing teeth, caries teeth. Likert scale format. Respondent asked to rate the extent to which they agree or disagree with a statement. Complementary therapies are a valid management option if used appropriately. Strongly agree, agree, neutral, disagree, strongly disagree. Rate item. Rate each item from 1 always to 5 never, according to how much of the time the statement is true of you. 1. I eat at least one hot balanced meal a day. If we use one hot balanced meal every day, we mark 1 always, and if not in any day, mark 5 never. 10 Format 10 Gutman scale. Gutman scale respondents select from a cumulative scale. If they choose C, it should follow that they have achieved A plus B. What is the highest level of education you have completed? If the respondent answer is intermediate, he or she achieved the secondary and matriculation. Question wording. Question need to be simple, clear, and precise. Worded questions can lead to ambiguity and misunderstandings, and you cannot then be sure that respondent has interpreted the question in the same way as it was meant. It is important to get the working of the questions right. Otherwise, the whole survey process can be wasted. Where possible, you should use standardized or previously used questions. These are valuable because they have often been validated and can also be used for comparative purpose. In many cases, specific evidence-based measure exist that will increases the validity and potential use of the data collected. Sequences and flow of questionnaire. The sequence of the question should be logical to the respondents and flow smoothly from one question to the next. Questions tend to flow from general to specific, impersonal to personal, and easy to difficult. The sequence of questions should not lead the respondent towards unavoidable answers where the answers to later questions are effectively predicted on the answers to earlier ones. Sensitive questions should not be placed at the beginning of the questionnaire. They should be placed in the section where they are meaningful in relation to the surrounding questions. This can act as buffer to help the respondent feel more comfortable with the sensitive questions. Filter or skip pattern can be used to ensure that the respondents answer only those parts of the questionnaire that are relevant. Filter question direct respondents to skip questions which do not apply to them. The quality of the data collected will be maximized if the wording and order of the questions are designed to motivate respondents and facilitate recall. This includes avoiding questions which are difficult to answer, time consuming, embarrassing, or personally threatening. Filter question skip pattern. Filter question unfiltered question. What type of contraceptive do you choose? Filter questions. Are you currently using any contraceptive method? 1. No. 2. Yes. If question number 1 answer is no, then skip to question number 3. Which type of contraceptive method? Different topics. Question relating to a specific topic should be grouped together. Complete question on the topic before another topic. Use a transitional question of passage when moving to a new topic. For example, now I will ask you question relating to your daily activities. Example, tips about the ordering of questions. Placement of background questions. No fixed rule about whether question socio-demographic variables should be at the end or the beginning. If the questions about education, income, or age are likely to be sensitive, but the issue being explored in the questionnaire are not, they should be placed at the end. They should be placed at the end. If the questionnaire is about more sensitive issue, they should be placed at the beginning. The length of questionnaire no longer than absolutely necessary 2 to 4 pages. Use branching question and skip pattern to reduce length of the questionnaire. Avoid deceptively short questions with high respondent burden, complex table, rank ordering, mental calculation. Check all that apply. Questionnaire layout. The layout of a questionnaire is just as important as questionnaire wording, and again must be clear and simple. The layout can differ depending on how it is being administered. Tips about the questionnaire layout. The overall visual impact is particularly important for moving the interest of the respondent with self-administered questionnaires. The questionnaire should be professionally designed or of sufficient quality to look like it has been. Enough space for writing should be provided with open-ended questions. The typeface should be large enough to read without eye strain. Different size and styles such as bold or italic can be used for contrast, but overuse of font styles should be avoided. There should be an introductory page or session giving the title of the study or program name of the organization, general purpose of the survey, and instruction on the general method of responding to the question. Instruction should be clearly stated and consistent. Each question should be numbered to avoid questions being omitted and the facilitate filtering. Numbers all pages and include questionnaire number on all pages. Emphasize any particular point in each question. What is the most usual headache treatment you choose? Subparts of questions should be intended below the main question. Questions and answers should never be split across pages. Always include a thank you at the end of the questionnaire. Please subscribe and like our channel and press bell icon for more videos.